Welcome back to another episode of Quick Hits. I'm your host, Tyler Smith, joined as always by Ken Booth. Today's conversation is exciting because we're talking about the intersection of data, innovation, and community impact with two incredible leaders from Health Choice Network, Alex Romillo, CEO, and Oscar Perez, Chief Applications and Innovation Officer. Alex and Oscar bring decades of experience in healthcare IT and a shared passion for advancing equitable care across federally qualified health centers. From leading one of the largest multi-state Epic implementations in the country to pioneering AI-driven documentation and patient engagement tools, they're proving that innovation and mission can go hand in hand. In this episode, you'll hear how HCN is empowering community health centers across the country to deliver more connected, data-driven care while staying true to their mission of serving patients regardless of their ability to pay. Alex and Oscar also share lessons in leadership, collaboration, and what it takes to turn technology into meaningful transformation for providers and patients alike. We can't wait for you to hear this one, so let's jump in.
Welcome to another episode of Quick Hits. I'm your host, Ken Booth, joined as always by Tyler Smith. Tyler, how are you today?
Ken, I'm so excited to be here.
Yeah, for sure. We're talking about one of our favorite things, which is data migration. And we have online with us today, Alex Romillo and Oscar Perez. Gentlemen, welcome to the show.
Thank you, Ken. Thank you, Tyler.
Thank you for having us.
Yeah, really glad to have you guys on. I was thinking to kick us off, Alex and Oscar, and maybe we could have Alex go first. Could each of you share a little bit about your journey into healthcare and then ultimately what brought you to the Health Choice Network?
Great. Well, I was always an IT guy. And so right out of high school, I went to school and started working at the University of Miami School of Medicine in healthcare direct. And we were implementing our first practice management system. And I was hooked on the opportunities that technology was going to have for both the patients and the doctors at the time. And I was on a journey to go into medical school, and that actually turned my entire journey into administration and IT and risk management and data. And I had met a federally qualified health center that was funded by the fourth largest public hospital in the country at Jackson Memorial Hospital, and fell in love with the idea that health centers see patients no matter their ability to pay. They're their primary medical home, and they provide one-stop shop from mental health, behavioral, dental, oral, podiatry, cardiology, you name it, whatever the community needs. And they were funded by the government in order to provide this. I didn't even know what an FQAC was at the ripe age of 21. And yeah, I started my journey. I moved away from the university and joined one of the health centers here in South Florida, Community Health of South Dade, where I met my first major mentor, Colonel Bruce Hartley Jr. And he was a founder of Health Choice Network. The network was formed just to share best practices and share expertise, both in value-based services and IT. And I was employee number 17, 28 years ago. I started my career here as director of IT, then moved into CIO, then moved into chief operating officer, and about 12 years ago became the president and CEO. I've never looked back. And this year we'll be hitting almost 400 employees. So, it's been good. It's been a good journey.
Well, that's awesome.
Sidebar question. What was that original practice management system?
It was a homegrown based system that also had some practice management solutions. It was called, Oscar, you may remember, it was called CARES. And then we moved over, the entire medical school moved over to a different system, which was Unix based. And then we ended up, the medical school went with Epic, and the public hospital went with Cerner. And the rest is history.
Awesome. So you've had quite a bit of experience with a number of different systems. Oscar, what about you? Tell us a little bit about your journey.
Yeah, great, Ken. Thank you. So I would say that, in a galaxy far away back 30 years ago, we I started in 1994 at the University of Miami, my healthcare IT career. Similar to Alex, where he was at I had the fortune to work at the Department of Anesthesiology there. I started there as a data entry clerk and became a data analyst, and really truly gained a passion for healthcare IT. Being able to get a sense of what's possible in healthcare, and kind of marrying for me technology and healthcare as a passion. Really drove me early on in my career. And so I spent a lot of time at the University of Miami. From the Department of Anesthesiology, I moved over to the networking, or I would say the IT department for the medical center. And there's where I learned quite a bit about networking and more of the technology side, the back end stuff of IT, and again truly got an appreciation and understanding for it. I was always known as sort of a Mac guy. I always had a passion for Macs. As a matter of fact, I'm doing this podcast on a Mac. Was able to really parlay that into just getting to work in different departments at the university, and being able to, again, learn a broader scale of how technology can impact different parts of healthcare. And so I took that and went consulting for a little bit, and traveled around the country to different healthcare systems across the country, and even in Canada some. And what that taught me early on was that, in healthcare, everybody's got the same problems. It doesn't matter if you're on the West Coast, the East Coast, North or South. It didn't really matter. Everybody sort of has the same sort of issues, and everybody's just tackling and working on it in different ways. And so that perspective really gave me the ability to coalesce that and be able to, fine tune how we can truly move the needle and truly get healthcare to not be a laggard like it is in, it's historically been with adopting technology, but be able to truly be able to be a leader in technology, and how we're bringing that technology to our patients and our providers, so that they can take care of the patients as best possible. And so from that consulting, after traveling 80-90% of the time and people getting to know me at airports and hotels, I decided it was about time to settle back in. And I came back to and then worked a little bit at Jackson Memorial Hospital, the public healthcare system right next to spent some time there and learned some valuable lessons there with, they had different challenges. They didn't have as much cash or financial wherewithal. And so during those tough times, we were able to still accomplish great deals. And that gives you a sense of appreciation. I think that if you don't go through it, you don't appreciate it as much. And so I was able to take that and then ended up working my way up the coast to Memorial Healthcare System. And I was there for about 10 years as the vice president of IT, and truly just, working with great people in all my stops and trying to get them to the next level, which was an exciting part. But during that time there, Alex and I had been having conversations. He was looking to change EHRs here at Health Choice Network, and he was very interested in Epic. I tried to sell him Epic from the Memorial perspective through Community Connect, but at the time it just wasn't the right fit. And so put him in touch with some of our Epic contacts, and he, did his magic and really showcased to Epic what Health Choice Network was all about. And I think Judy and Epic had no choice but to sell it to him and to our health centers. And so during those conversations, we talked about him need what he was going to need to get the program off the ground, and he was gracious enough and had brave enough to have confidence and ask me to come over, and it was just the right time in my life. And so came over, and it really has been an amazing 5 years here at Health Choice Network. The biggest difference that I've seen in all my travels and all the health systems I've been in throughout the country and here locally is truly that Health Choice Network is, really about the mission, and not just says it, but does it. Starts with the leadership here, starts at the top for sure, and we really are doing great work. It's really remarkable and really rewarding to be able to do what we're doing on a day in and day out basis for our communities and for our health centers. And so it's been a great few years, and I'm really excited about what the future holds. So.
Oh, that's great. And just simply based on his passion, I can't say that Judy would have even stood a chance. Alex is very convincing. It seems very passionate in his mission. So, no, that's great. So, Alex, tell me, as CEO, then, if you could describe the mission and role of HCN in today's healthcare landscape, and particularly when it comes to how you serve community health centers and how you help them serve their patients.
Yeah, a pleasure. So, Health Choice Network was formed 34 years ago as the first funded health center control network, which means our entire mission is to help health centers. And it was an interesting mission at the time because technology was not what it is today. So if you look at our goals 34 years ago, it was really to make sure the data was available and that we can track Medicaid patients and provide some level of primary care access, meaning get patients through the door, not just through walk-in. Our mission has evolved through the 34 years, and we still today are the only network that focuses specifically on federally qualified health centers and safety net providers. We do not move into other spaces. We understand our lanes and we understand our goals pretty clearly. But we do partner with everyone. We partner with the hospital associations, the value-based services partners, and our job and our mission and vision is to make sure that health centers are a critical aspect of the healthcare delivery system. Since we health centers across the country, see 35 million plus patients every single year.
Excellent. But while we're talking about applications and just technology, Oscar, your role specifically focuses on applications and innovation. If you could tell me about just some of the exciting initiatives that you're leading right now that are transforming how providers use technology.
Yeah, no. So I mean, obviously, the first one that comes to mind is we, kind of one of our main missions here in NHCN's main mission has always been to bring technology to our health centers and help them, bring the latest technology regardless of cost and price, and have that here at the disposal of our providers and really the patients that need it the most. So we have been on a journey of implementing Epic as an EHR to our health centers. We've implemented it over 30 health centers across 9 states, including territory and Puerto Rico. And that, it's a challenging endeavor because it's really 30 different entities, 30 different CEOs, 30 different CIOs, different state regulations. But being able to do that on a single instance and being able to do that and being able to standardize it is sort of a utopia that I think many of us have had in being able to have a standardized workflow, being able to have great analytics for our providers that they can compare themselves to and benchmark themselves to, and then bringing the best tools to our patients so that they can get engaged in their care. And so it's really been exciting. It's really been very rewarding over the last 5 years to be able to do that here with the whole team, and we're really seeing the benefit and the satisfaction on the provider side. I'm not sure if Alex mentioned this, but from a class perspective, we have tremendous high physician satisfaction scores across the board, and that's again, it's a testament to the methodology that we have here, to the training that we have here, and to the product that we're putting out there. So that's been very, very exciting to see.
I was lucky enough to get to participate in the Puerto Rico sites, and it's just fascinating how the level of excitement you all bring to these go lives is novel, even to the other, many go lives I've been throughout my career. Bringing everybody into the next phase together, this celebration. But I know there's also a lot of innovation that you all do outside of just this blocking and tackling on excitement. And so, would love to hear a little bit more about a recent project where innovation made a measurable impact on both the clinicians and patients.
Yeah, no, quite a bit. I think, no technology conversations can go out today without talking about AI. And I know that I'm sure we'll be talking a lot about that here throughout the day, but the potential and the promise of artificial intelligence and generative AI in particular in our space with healthcare is really, really promising. And we have been seeing quite a bit of that in the provider space. And so we've been able to see things like, being able to do ambient notes with the provider, being one of the most highly adopted technologies we've seen across the board. It starts with a center telling us, oh, let's just bring on 5 providers to do some ambient notes. And that's, where the conversation gets recorded between a provider and a patient. The recording goes up to the cloud if it's up and running. And then an AI generated note comes back with, none of the noise. And it's been really, really amazing to see the adoption of that and the rewards. And I always say that it's really three. It touches on the 3 pinnacles of a health center many times. It provides provider satisfaction, it provides patient satisfaction, and it provides CFO/CEO satisfaction. And the reason I say that is because the provider gets to not have to spend their time looking at a computer and documenting. The patient actually gets to talk to their doctor, which is amazing. Imagine that. And then the CFO and the CEO get to see more productivity from the providers. And so it really is a win-win for everybody. And that technology is advancing even as we speak. So not just being able to generate a note, but in the future be able to generate orders, medications, and really truly make it a truly ambient visit for the provider, where they're just walking into the room, having a conversation with the patient, and everything happens automatically in the background.
And you're not just saying CEO enjoyment because Alex is right here on the podcast with us, but as we talk about innovation, back to you, Alex. Like, what leadership lessons have you learned? 28 years at HCN. Like, you've been through rapid change recently, but also just general big changes over that period. And I just would love to hear about the technology adoption and how that's taught leadership lessons.
Yeah, it's interesting because you look at the journey, and I always would like to reflect on how we started and what our priorities were. As Oscar mentioned, innovation for us is we have to be able to see more patients per day. The community is growing, our population is increasing, the healthcare disparities are growing, the social determinants of health affecting our communities, the diversity of our communities, and the health centers are literally the front lines of defense. We're the ones that keep costs down. We keep patients out of the emergency room. We do proactive care. And so if you look at technology innovation, one of the reasons why we bit the bullet and spent every dollar we had on Epic was, one, to make sure health centers can exchange data with their local pharmacy, their local hospitals, their local payers, their local referral specialists. Number two is make sure that we can innovate as fast as possible. Oscar's primary role for me is not just implementing technology, because anyone can implement technology. It's making sure that the workflows, the promising practices are shared. If you look at the private sector and even the public hospitals and the hospitals that have lots of resources, identifying a workflow for a diabetic patient that's homeless is very difficult, specifically where they live in a food desert, they can't keep their insulin properly refrigerated. And so I can go on and on about the challenges that our health centers face that usually the primary care private sector does not face. And so innovations such as that AI that Oscar was talking about, we spend a lot of time just trying to make sure claims go out the door for those funded patients like Medicaid. Now we're no longer spending time on that. We're spending time on making sure the documentation is properly captured. And we've done really well on risk-based contracts. No one thought FQHCs would be the primary reason why Medicare ACOs and risk-based contracts are now saving money, saving the government money, saving taxpayers' dollars. And that's because of innovation. We're no longer focusing on the paper and the shuffling of paper. We're focusing on doctors seeing patients, care coordinators coordinating care, getting patients out of the hospital when they're admitted, and back into their primary care. Primary care saves money. And the innovations around that, and the fact that doctors now can see one or two more patients just because, as Oscar put it, they're not dealing with the noise of codification. No doctor spent 12 years of their education trying to be a coder. And every time I walk into a health center and I hear the providers are having coding issues, I always say, well, you're having an administrative issue, not a doctor issue.
You guys have both touched on that a couple of times, just giving patients the ability to have these conversations with their doctors. And this is kind of a trend that we're seeing with AI. There's fast adoption, at least to, how can AI make things better? How can it reduce provider overload? But now we're kind of seeing this balance where it returns to a little bit more of an analog in terms of reinforcing that human connection. So you mentioned like the homeless patient or some of the other patients in communities. How has being able to have more of a personal connection with a provider who's less likely to burn out, how has that benefited patient care?
Well, I'll start from the mission and let Oscar jump into the specifics of it. But I'll give you another real world example. Physicians didn't go to medical school to do paperwork. They can care less about codification or claims. But if you ask a patient, do you know where you get your next meal from? And the patient says no. And then the physician has no ability to manage that or provide a solution. that's where the burnout comes out. The doctors want to see patients. Their mission is to take care of people. They went to medical school to help. And then all of a sudden you're asking them to ask questions that they don't have a solution. I've seen physicians pull money out of their own pocket to give it to a patient so they can get their medications. That's not what the medicine of, the most powerful country in the world should be providing, but that's what health centers do. They do whatever it takes. So now fast forward to today where you have technology where we can now connect patients with their food banks, with their local transportation tokens. We can actually make an impact in that patient's life. We call it healthy body, healthy soul. Mm-hmm. It's not just the body. We have to treat the fact that they can't pay their rent, that they've lost their jobs, that we have a lot of patients that were fully insured, that were proud caring members of their private insurance that lost their job or their employers can no longer fund healthcare. And now they're seeing themselves for the first time as uninsured. And so the innovation for us is more critical than any other sector in healthcare. Us keeping the administrative costs down so I can hire another care coordinator or another nurse or another advanced practitioner or another doctor and not have to hire another front desk staff or another coder or another biller. I mean, if you look at health centers' admin rates across the board, they're the lowest in the industry. And that's because we got to really look at every corner. And back to Oscar's journey, all of us came from very humble beginnings. So the idea that we have to be innovative to keep costs down, but there's still a full waiting room and sometimes a line forming outside at 7 a.m. For patients to be seen. Another real example I'll use is we have an amazing health center in Providence, Rhode Island, called Providence Community Health Center. They open their dental doors for free dental care once a year. It's a whole weekend. And they have the police and the local officials have to show up because patients start lining up 2 days before Saturday morning's 7 a.m. clinic.
Wow.
So the need is there. And so now imagine this, we're printing out 3D printers are printing out dentures and implants. And if you see the amount of dental providers from the community that participate in this, the amount of health department and government officials and everybody's, it's obviously a great photo op, but to see a community that lines up in cold, in rainy conditions, and they're there all night just because they're so needing of dental care. Imagine if you went to your first job interview and you were missing your 2 front teeth. How confident would you feel? Right. And so that's the impact of technology. It's not just the technology and the EHR, but it's also 3D printing, the ability for us to actually solve a patient's issues at the point of care without having them to come back. And most of the time they won't come back because they have to pick between going to work and going to the doctor. They don't have PTO. They don't have vacation hours. They're working, they're the working poor.
Let's take a quick break. At Health Data Movers, we know that data migration isn't just about moving information from point A to point B. It's about making sure your clinical and operational data is accurate, accessible, and secure, so your teams can focus on delivering care, not chasing records. Whether you're consolidating systems, switching EHRs, or sunsetting legacy data platforms, our data migration experts help you move confidently through complex transitions. We bring proven tools, repeatable processes, and deep healthcare experience to make your migration seamless. If you're planning a system change or even thinking about one, let's talk. You can learn more at healthdatamovers.com. Now back to the show.
I mean, what a powerful example. And I mean, truly, you all live with this impact in mind. I will also say, we talk about AI a lot on this podcast. We haven't actually gotten to 3D printing, so that's probably the first time it's made it on here. You also, Alex, I mean, you're pretty well known in the industry for, and maybe you'll correct me if the mythology is incorrect, convincing Judy to allow you to bring Epic to all these FQHCs, which is remarkable. And also, you've hit the cost cutting or the cost containment, but you've also, you see where there's opportunities to make investment. And you in that investment in Epic, and you just get so much more leverage out of that EHR is the assumption I had. But yeah, would love to have you comment on that at all, or even if you want to go deeper, and Oscar could chime in on this one as well. There's that transformation to Epic is obviously one of the more complex pieces I would think that you all tackle, and just love to hear how HCN approaches those large scale migrations and what advice you give other organizations preparing for one. I know there's a lot in that question.
Yeah, but I mean, I'll have to, pay homage to those that came before us. So we have great partners in the industry, like Ocean, for example. They were rolling. They had the foresight of working with Epic early on. Their model's different. They have a great model for FQHCs, safety net providers, but also in the private sector and hospital sector, and they were working with providers in the community, which I think is, Abby and the team have done a great job there. When we went to Epic, and it took about 8 years to negotiate the deal. Judy was, she saw the vision. She saw the fact that we're different, that we are, Epic for us is not a financial benefactor. It doesn't bring any dollars to the bottom line. As a matter of fact, we have to figure out foundations and grants to cover for a lot of the expenses because we cannot pass those dollars onto our health centers. And so when we went on this journey, it was almost like Shark Tank with her and her team, which were amazing, by the way. I had to pitch why we were different, why we didn't have the money, but we were going to figure it out. Why, by growth, we would be able to bring volume-based discounts to our health centers. And the fact that the FQAC business of healthcare is very different than the private sector business. We're not on a PMPM model, which is a per patient per month model. We're basically at risk the whole time. So the way we did the model was we have 10 years to figure it out, which means we have to grow. But at the same time, we have to continue innovating. So like, for example, this past month, our board of directors just invested another $3 million into the model of our own hard work dollars from value-based services. So we're like the Peter Pan. We take from value-based services and grants and foundations and local charities to really fund the technology, because we know if we can keep the kids in foster care and healthcare, they won't end up in jail. If we can keep the homeless shelter full instead of on the street, there's less crime. If we can see a pregnant mom in the first trimester of their life, that's a baby that doesn't end up in the NICU unit that costs $1 million for a delivery versus $800 that Medicaid pays for. So the vision was, could Judy and the Epic team see through the mission and vision? And they did, and they invested in us. And I will tell you, and you don't hear this a lot, but Epic's been one of our best partners across the last 34 years because they've helped us finance, the things that we can't afford, and knowing that we're growing. And it's been a great market, and that's why I had to get Oscar, for Memorial. I did this whole. I looked like a recruiter at one point. I was going out into the industry and finding the best of the best that also were focused on mission and vision, and say, Oscar, take a leap of faith with me. And we knew each other for a long time. We're best of friends. But at the same time, I was like, hey, I know this is your career, but we have an opportunity to do something that no one's done, which is the first FQHC Epic build that we're going to keep up to date. We're going to upgrade it. Every time there's an upgrade, we have to be the first to upgrade because I need that innovation. It's not a benefit or I want to put a feather in my cap by being a HIM stage 7 type installation. My feather in the cap is if I can get that AI technology rolled out faster, that's an FTE that I can save and really invest back in the health space. So I'd love to see Oscar's point on this because I see it from the board vision mission perspective, and the fact that I had to create a performer that looked like Shark Tank, but he's the one that took the leap of faith as well to help create the vision into a reality.
Yeah, no doubt, Alex. I think that it's just thinking back 5 years ago when we had those conversations, and even further back when you were originally having the conversations with Judy and Epic and sort of the sales pitch, if you will, or the Shark Tank. And I think, what really struck me about Health Choice Network and what Alex has done here and the team have done here is a lot of people talk about culture, a lot of people talk about mission and vision, but this organization truly does walk the walk. And, obviously it starts with leadership at the top. And it's something that really has been remarkable for me to see, because many organizations will say, yeah, no, we're about the mission and vision, but, behind the scenes is not the case. Here, it truly is, what's best for our health centers? How can we bring them the best technology? How can we lower their costs? And that really is a big sort of North Star for us here at Health Choice Network. And the exciting part for me was being able to, bring this technology to truly, to the providers and the patients that truly need it the most, right? If you think about it, being able to have providers that are working at FQHCs, not working in the private sector, and patients that, as Alex mentioned, may not have a job or have, several kids, and they have to balance, their life and their social determinants of health. Being able to do that is truly been very rewarding, and what we like to say is we want the centers to move beyond the EHR. Right now it's not, well, I'm on this lesser technology and the system is down, or it doesn't do what I need it to do, or et cetera. Now it's about, how can I be more efficient using it? How can I automate parts of my business so that I can reinvest that back into the patients? And that's really been what's really getting us exciting from the innovation front, because with AI and with other, and having Epic as that foundation, we're truly being able to move forward in a way that I think wasn't possible with the previous technologies, because you're constantly worrying about some of these other things. And so yeah, it's been pretty cool. And I think we're at the precipice here too of so much advancement with being able to automate parts of the healthcare space that are redundant or repetitive. On the financial side, we don't talk about it a lot. I mean, we do talk about it a lot, but it's not as sexy as on the patient and provider side. But there's a lot of opportunities there to automate that, and we're already doing some of that here at Health Choice Networks for our centers.
That's great, and I'd love to hear the collaboration and just the partnership that you two have that feeds into your mission. You talk about challenges. Obviously, one of those challenges with a growing network like yourselves is data migration, right? And that's usually the most complex part of any kind of digital transformation, whether you're going from a legacy system into Epic, or as you're absorbing new clinics. So how has HCN how have you guys approached these large scale migrations? And if you could maybe give some advice to other organizations that are preparing for an undertaking like that.
Yeah, I can start from the planning perspective, the budgeting perspective, and then Oscar can go into the details. But one thing that we're not here at Health Choice, we're not a consultant. We're not a vendor. I always say I don't have anything to sell you. I just look at the market, try to negotiate the best deal I can and lower costs for health centers, while implementing the technology the way it was intended to be implemented. Versus, many times you implement technology and like AI, it's like a shiny star, but no one's asking the question of what's the problem that we're trying to solve. So we take up that approach. When it comes to data migration, many of the vendors have held the data captured as an asset, which means, when our Medicare ACO, many of the other EHR vendors will charge over and over and over again for the same interface, for the same EHR, for the same data warehouse or data lake, or whatever the new term is. That's not what we do. And so one of the things that we did early on was we have one of the best in the market, told to us by Microsoft and by Epic, not just by me, because I'll put my team against anybody anytime. But when you hear these large scale vendors like Microsoft and Epic saying your data team is the best out there, we've learned that a couple things. One is that conversion cannot be a barrier to moving into innovation. And so we've built our entire data team model. We've brought in some amazing partners like HDM and others to be able to ensure that we can actually bring the data in it and use it. We don't charge if we build the interface once for the EHR. We'll never charge for that interface again. And one of our guiding principles, and as Oscar always puts it, is Epic first, is we want to make sure that if we've already done the work with a specific EHR or a specific state HIE or a specific state immunization registry or a Medicare CMS, 35 files every month, we do it once, we do it well, we establish it, and that way every other health center that joins us after that, they don't have to take up the programming, the planning, and sometimes the decision of should I bring data over or not. Many times for health centers, the conversion of data, the interfacing of data is a numbers game. And so they'll actually say, I can't afford to bring over all the patient data that I have, even though it's such great data, because our data for health centers doesn't live in any other database. The uninsured data does not live at CMS. It doesn't live at the state Medicaid offices. It doesn't live in a payer. It lives within that health center. And so for us, the tactic was we can't leave any data behind. It is too valuable to the entire population of healthcare, especially surveillance of diseases like when we had COVID. I mean, the health centers were the first on the grounds doing surveillance, testing, and screening in the parking lots. Why? We had the data, we had the technology, and we knew Alex Romillo was the patient that's been with us for the last 20 years across 15 EHRs. So for us, data migration, data interfaces is survival. It's not an option. And so we had to get rid of this cost cloud that people have figured out that they can make money off holding data almost for ransom. That's not what we're about. And so one of the other opportunities that we've had with Epic is, we've got rid of every third-party data strategy. It's all inside our Epic database. So now, even if it's data from a different EHR or data from a different payer that's not necessarily live with Epic or on Epic, we still bring it into Epic. And so we have one big FQHC data lake.
That's great. And that's a great perspective to have. And especially, appreciate how you see the importance of that data and even making sure that that carries over from, center to center to center. So that kind of leads me to my next question. And when it comes to migrating between systems, you think about the different factors. You need speed, you need accuracy and usability. And it's almost like sometimes it's like you can only pick two. So how do you strike the balance for your members? How do you make sure that they get a quick, accurate, and usable data?
Yeah, I can jump in here. I could say that, that Alex, as Alex mentioned, in all of our implementations, we convert the data from previous EHRs into Epic. And, part of that is, we have, clinician leadership helping us advise. So it's not just the technology folks, although we do have the most amazing data people on the planet, as Alex mentioned. But it's also, it is about also validating that data and making sure that, as the famous cliche goes, right, garbage in, garbage out, right? So you want to make sure that you're validating that data, that you're having your users validating, that your clinicians are validating it, and that you're bringing it in and mapping it to the right places so that you can get the most out of that data. I would say if I had to pick two of the three, of course, accuracy is number one. And number two is usability of the data. I think speed, you kind of inherently get it if you're, if you have experience converting or migrating data from particular systems. So the more data that we convert or migrate over from Athena or eClinicalWorks or others, our team already has a template and a standard by which they're able to bring that data in, map it appropriately, and it's a matter of validating that data that comes into our system. But we do have a lot of conversations in our projects with the customers and our centers. Everybody feels like they need all the data since the beginning of time. And as Alex mentioned, I think in our situation with community health centers, because our data sets are not really in other large data lakes or data set environments, it becomes very important for us to make sure that our patients are represented in whatever data models are being used, whether it's Cosmos for research, whether it's large language models for AI. We need to make sure that our patient population data is included in these data sets. And so we take that very seriously. And I think that we've been very successful in converting data over, and it's something that we're very proud of here.
Yeah, if I could just add one more piece of that, which I think is pretty important for our mission, is even with the large data models and artificial intelligence and everything we've talked about, we can't ignore the fact that data has been used as a weapon for a lot of our communities. And so we're very cautious of that. So when it comes to AI, we want to make sure that all parties are represented, all cultures, all backgrounds, because healthcare is about treating the person that's there in front of the doctor. And so we have people in governance on data models. So we have our amazing clinical team and our amazing research team that participates in every data strategy out there from a governance perspective to make sure that all patients are included, and that one, the data is not weaponized, and number two, the data is available accurately, as Oscar pointed out. For our patients, they trust our health centers to be able to treat their ailments and treat their diseases without any bias, whether their ability to pay or their home economic status. And I think that is one of the reasons why we call the health center a movement. It's a movement to take care of all. and we let other people deal with political stuff. And our job is to treat everyone that walks through the door fairly and with the best care possible.
That's amazing. Yeah, what incredible perspective, and just I'd love to hear how you focus on keeping the patient care front and center. So, gentlemen, looking at the future, what role do you see community health centers playing in this national conversation? You talk about having members involved in governance and making sure that health equity is important. Is that really the future that you see HCN playing when it comes to providing value-based care, that health equity and digital health transformation?
Oh, absolutely. I mean, I'll give you some real world examples. And I touched on a couple briefly, but health centers are that fabric. And, if you look at the success of the CMS Medicare Accountable Care Organization model, billions of dollars saved because folks were using Medicare as a bank. And all of a sudden you bring in the FQHCs into it, and now the savings are going directly into the community. So when we see, $80 million in savings across 12 years, those $80 million are being reinvested back into the community with new bathrooms. We have mobile vans now that go into the community and do oral health at the schools. We do showers. For example, we have health centers that have mobile showers for the homeless. And so now you can start seeing the impact of those dollars in savings. We're obviously at risk in these models, which, sometimes it's 50-50. So if we save $1, CMS keeps 50 cents and we keep 50 cents. Well, that 50 cents for health centers gets invested back in the community. It's not a CEO bonus or a helicopter for an executive to travel around. And so that's number one. And we can use those dollars to be able to reinvest in the care. Our challenge is that the cost of care continues to go up despite our best efforts. And a lot of these technologies like artificial intelligence and machine learning are all transactional based. And the health centers, if AI costs you $1 PMPM, so it's $1 per patient per month, but 85% of your patients are uninsured, that's $85 that I can't fund. Mm-hmm. And so we're trying to change the conversation with our payers and with our vendors like Epic and others, which have been extremely open to this, is you can't treat us the same like you would treat a hospital that gets paid on a per bed basis per day. We don't know who's walking in the next day, and we also can't turn anybody away, and nor do we want to. But in our bylaws, we can't turn patients away. So if today 100% of the patients show up are uninsured, well, we're seeing 100% uninsured, and there is no bill being generated. There's no Medicaid dollar coming in. And so that's the beauty of health centers, is that we can lower cost and provide great care. But our job here at Health Choice Network is to use the masses, the volumes of growth. Our strategy is not to sell things. Our strategy is the more health centers come together and work with us, the lower we can keep the costs. And so some vendors would tell you, well, if we can lower the cost today, well, I can tell you every time I've gone to the board of directors, which is made up of FQHC CEOs, and say, hey, we have the chance of lowering costs. They're like, no, reinvest it. Keep the cost down. Reinvest it, which is how we got into AI. I mean, we were the first to roll out text messaging via Epic. Period. I mean, we had hospital partners asking us how we did it. And so innovation for us is survival. It's not necessarily a luxury. And I think by keeping HCN involved in risk-bearing contracts like ACOs, working with payers to identify the fact that health centers are the lowest cost model out there, and proving it via ROI, I think that is a strategy we can bring the private sector dollars into the public sector.
Excellent. No, thank you for that look into the future. Well, thank you, gentlemen, for joining us so much today. We just have one final question, and that's if you have any advice for our listeners when it comes to leading through innovation in healthcare. If you could give a little bit of advice, what would it be?
Yeah, I always remind folks that technology, artificial intelligence, all the latest buzzwords and the latest technology is always going to have a draw. I think for us, and the advice that I would give all is make sure you document what the problem you're trying to solve is, and or what the challenges you're trying to overcome are. And it can't be based on perception. It can't be just my EHR is no good, or I can't do this, because there's always ways around it. And I guarantee you can find others that have found a way around it in the current technology that they're using. But if you can properly spend 3 to 6 months documenting the workflows, documenting the problem, documenting what does utopia look like? What is the end game, and how can you document the problem, the solution, and what the ROI would be? Because I promise you, it's going to change once you figure it out. And I think people just gravitate naturally to get the latest, greatest shiny star, and then they're always disappointed, even though the technology is doing exactly what it was designed. In my 30 plus years in technology, I'll tell you, half the shortfalls or half the hearts that have been broken by implemented technology is because really their expectations and their budgets, their project plan, their resource allocation, and what the problem was supposed to solve never met the mark. And I encourage everyone that this is not a top-down process. You have to involve everyone, the physicians, the nurses, even the environmental staff that's cleaning the facilities at night. You have to involve everyone that touches the problem that you're trying to solve or overcome, or the challenge. If not, I promise you'll be let down no matter how much money you spend.
Yeah, no, that's so true, Alex. And we talked a lot about technology here today. And again, Alex and I are both tech nerds at heart, and very passionate about technology. But technology today is old technology tomorrow, and the beauty of technology is that it is always changing. It is always, you think you have the latest and greatest, and then tomorrow there's something better. And so it isn't about the technology. Technology, I know people say it's an enabler, or it's a tool, or whatever the case may be. It's really about, the advice I would say is, surround yourself with great people. Smarter people than you. That's something that we do here at Health Choice Network is, we recruit the best of the best, and we're trying to, have people that ask those questions like Alex is talking about, like, ask the whys. So many times customers and vendors and everybody comes to us telling us what they want and what solution they want versus telling us what that problem is. And so asking the why is critical. And I would say too is, just a last piece of advice too is, we want to do all these great things, and the truth is, you can't do it all. Staying focused and being able to decide what to do, but more importantly, what not to do, I think is something that, takes discipline, and it takes an ability and a focus that I think here we try to do. And even though we do try to do it all for our health centers, it's important to be able to understand, what you're capable of doing, what you have the bandwidth to do, and then be able to truly focus and put all your energy behind those things that you focus on doing.
Excellent. Well, thank you so much, Alex, Oscar. Really appreciate you guys taking some time out to chat with Tyler and I. Insightful conversation, and we just really appreciate the work that you guys are doing at Health Choice Network.
Well, thank you as well. This was great.
Yeah, thank you, Ken and Tyler.
Thanks again for listening to Quick Hits, a healthcare technology podcast for healthcare technology professionals. Follow us on Spotify or Apple Podcasts, and don't forget to reach out to us with feedback, suggestions, or even people in the healthcare technology industry you think we should interview. Send an email to quickhits@healthdatamovers.com.